According to the Associated Press, the H1N1 flu spreads in the same way that regular seasonal influenza spreads, mainly through coughs and sneezes of people who are sick with the virus. And the Center for Disease Control has developed a diagnostic test to detect the novel H1N1 virus, and now has distributed all test kits to all states, including the District of Columbia and Puerto Rico. The hope of that, of course, is that better reporting will create better tracking and implement better reactions to the virus. The Center for Disease Control has also identified those segments of the population as being the most at risk. Those are children under 5 years old. By comparison, the normal seasonal influenza we see is mostly a problem for children under 2 years old. So children between the ages of 3 and 5 are at a higher risk than they would be with the normal flu. Also at higher risk are adults 65 years of age or older, or people that are normally having problems with chronic pulmonary, cardiovascular, renal, and neurological problems. Also at risk are those folks that have problems with the immunity problems. Oddly enough, although those are the folks that the Center for Disease Control are most concerned about, the people that seem to be the most affected in Mexico are between the ages of 25 and 45. Symptoms for the H1N1 flu virus, very similar to the seasonal flu virus, which is giving some concern to folks as we head into the winter season in the southern hemisphere and what will be the winter season for the northern hemisphere later this year. Those symptoms, of course, are fever, sore throat, cough, runny or stuffy nose, body aches, headaches, etc. The Center for Disease Control suggests that we avoid contact with others. You are, according to them, with folks infected with the H1N1 virus are contagious 1 day before they start to feel symptoms, and then generally contagious for 7 days following that. The World Health Organization is cautioning that the antiviral drugs not be given to everyone and only be given to those patients at risk. 2 reasons why that warning has gone out. One, they want to make sure there's enough stock around to take care of the people that are the most sick. And the second reason being that they're worried that an overprescription of these drugs may create a virus that's more immune to them. There is concern through the World Health Organizations and the other organizations like that the H1N1 strain will combine with other flus like the avian flu and create a very lethal dose. This has happened in the past with other pandemics where the introduction of a flu virus like swine flu has later become problematic in the later stages of its development, but not at the initial stages.